Hello, and welcome back to the video series on senior housing and senior housing development in Eastwick, Philadelphia. This video will be about best practices for senior services. This is a part of the videos on senior services and housing approaches for Eastwick, Philadelphia. There is an alternate strategy to meet the needs of seniors in the neighborhood besides housing, aging in place with community resources. This section will address why aging in place is an attractive option, case studies for areas relevant to Eastwick with aging in place programs, best practices for aging in place services, and local Philadelphia resources that help residents to age in place. Aging in place allows seniors and senior residents to continue living in their homes. This is the major draw of aging in place, of course. It allows people who love their homes to continue to stay in them. The mental wellness and peace that this allows cannot be understated. Beyond this, though, aging in place saves seniors who own their homes around $75,000 on average, and in Eastwick, a plan that focuses on allowing seniors to age in place would reduce development pressures in the neighborhood. However, aging seniors need, in part, the specialized services that senior homes provide. Things like lack of consistent access to medical care, lack of amenities, and a lack of senior community are constant threats to individuals who age in place. At a wider level, there's no consistent funding for seniors who wish to age in place or organizations that provide programming for them, unlike with housing grants. Senior programming grants are fewer and farther between. With that in mind, a case study that has responded to the needs of seniors who wish to age in place. Even with these challenges, organizations like the Center for Independent Living Options, or CELO, provide for their aging residents. CELO is a Cincinnati-based organization that serves low-income elderly and disabled residents who wish to age in place, helping them to develop independent living plans and providing medical support and community outreach to senior communities. Notably, CELO services a largely Black population, while many other senior-serving organizations focus on white or immigrant constituencies. Demographically, this aligns this organization with a neighborhood like Eastwick, providing a glimpse of how a senior-serving organization can move through the world of racism within health to provide equitable outcomes for its clients. This organization is largely funded through donations and philanthropic support, with government grants from the states that it's involved in making up a small part of their funding. This Philadelphia organization, the Northeast NORC, shows that aging in place is possible within the city. A NORC is a naturally occurring retirement community, this one being composed of over 65,000 people in the northeast of Philly. Serving primarily Jewish residents of the Northeast, Northeast NORC provides a number of practical, medical, and social services to residents of the area. Anything from medical transport to grocery shopping to friendly visits are allowed for residents. And this is largely financed and organized by the Catholic and Jewish charities in the Philadelphia organization that manage this, but they are also a recipient of the rare Federal Administration on Aging grant. From these cases and others, we learned that there are two very impactful aspects to empowering a naturally occurring retirement community. Providing the specialized services that seniors need means providing not just medical service, but transit to and from medical centers, home repairs, and investing in public space to give seniors places to congregate easily. Seniors who have opportunities get involved in their communities also benefit in a major part from these projects. Volunteerism, artistic education, field trips, or other sorts of engagement programs help retirees find new roles in their community. To conclude, here are some Philadelphia resources that service all elderly residents in need of public space, community engagement, or specialized services. Services like Penn's Village, the Supportive Older Women's Network, and the Life Program provide senior resources to elderly people citywide, while the Ralston Center, the Southwest Senior Center, and the various community gardens citywide provide public spaces for seniors to interact with one another. With all these resources together, while not specific for Eastwick, They provide a potential fabric that Eastwick residents can draw from should and improve should they wish to age in their homes.